Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Thank you for tuning in to Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. I'm your host, Joel Berg. We're here today with our first ever panel for Pedo Teeth Talk, and I'm really honored to have with me three dentists from New York City. A lot of us have talked about the experience with COVID-19. For the rest of us in the other 49 states or even other parts of New York, yet we hear as outsiders about the challenges facing those who live and work in New York City. So we're honored to have with us three dentists who will give us different perspectives today. So I will introduce them, and then we'll go right into the discussion with our guest today. So first I have Dr. Lois Jackson. She's a pediatric dentist with offices in Soho and Brooklyn. She's president-elect and also acting president of the New York County Dental Society. She received her dental degree from Columbia University and also pediatric dentistry there. She did her residency at Montefiore and has done many things that with the American Academy of Pediatric Dentistry, for which she is extremely well known. And I'll ask you to take a look at her bio and full report about all the things she's done online, along with the other guests today. Our next person with us today is Ioana Maxillofacial. She's a board-certified pediatric dentist also in private practice since 2002, and she received a dental degree from New York University in 1999, and then her certificate in pediatric dentistry from Interfaith Medical Center in 2002. She has participated in numerous visits to New York City schools, educating students about good oral health, and has done some very special things during this pandemic. And we'll talk to Ioana in a minute. And then finally, our third panelist is Dr. Suchi Chawla. Dr. Chawla is a board-certified oral and maxillofacial surgeon practicing in Midtown Manhattan. She attended the University of Virginia and graduated with honors, earning her doctorate in dental surgery. And then at the New York University, she got the DDS rather. She subsequently earned her Doctor of Medicine at the prestigious Mount Sinai School of Medicine. She went on to complete a general surgery internship and her residency in oral maxillofacial surgery, where she served as the chief resident. Dr. Chawla has taught dental ethics in both New York University and at Columbia University, and has been very active in her practice and in the hospital before and during this pandemic. So, ladies, thank you so much for joining me today. We're really honored to have you. We're going to go kind of in order, and I'm going to start with Lois. You and I have known each other for a long time. I know about your work in New York. Now you're the acting president of the Dental Society. So, as I said before, those of us outside New York don't get the full picture, and we know New York has really been hit hard with this crisis, but New Yorkers are special. New Yorkers are resilient. What makes New York City residents different?
Well, Joel, New York City is known for many things like Broadway, the Empire State Building, Central Park Museum, the museums, music, great food, and that's basically why we live here. Many people say it's a noisy city, which we usually don't notice, but we did notice when it became very quiet, and the only thing you heard day and night were sirens of ambulances racing through the streets. Thankfully, there are fewer ambulances racing to help people as we flatten the curve, but the rhythm of the city has not yet gone back to normal. We call it New York tough, and that's what we are, New York tough.
I love it. And those of us who come to New York as much as we can, we feel that toughness, and we've been thinking about you for a long time. So, Lois, tell us a little bit about the timeline for the outbreak and what's been happening in New York a little bit more specifically.
Okay. So we had been hearing about about COVID-19, and the first case in New York was on March 1st. That was a healthcare worker who had returned from Iran on February 25th. She and her husband quarantined in place. And after that, we found that about a month later, the metropolitan area was the worst affected area in the country. And by April, the city had more confirmed coronavirus cases than China. And by May, we had more cases than any country other than the United States. So we were hit hard and fast.
Wow. And are you seeing, you just referred to things are getting a little bit better now. Is that correct? Or
Mhm.
starting to ease up a bit?
Yes, because of social distancing, wearing masks, um, sheltering in place, we've been flattening the curve. Fewer
Wonderful.
cases, fewer deaths.
Yes, well, it's all good news, getting better news, I should say. Ioana, I wanted to ask you about this interesting work and really great work you've done together with the New York County Dental Society to assist members during the crisis. Can you tell us a little bit about that, please?
Oh, yes. Actually, the day that we closed our dental offices, which was March 20th, an idea came to a few members to get together and try to help our um, medical colleagues. It seemed that we didn't know how to help. We were basically couldn't go to the hospitals. They were not accepting dentists to help out as nurses. So the only thing we could do is collect as many as PPEs as we could from our offices and give it to the emergency rooms. And at that time, on March 21st, I had 2 phone calls from members that basically said, we don't care about social distancing. We're going to take the supplies from the offices and by ourselves, we're going to drive them to the emergency rooms. And within a 3-day period, we got about 30 volunteers, true New Yorkers, and about 8 people that willing to drive the supplies to the emergency rooms by themselves with no help. We didn't have any contacts. We only had friends that used to work in the emergency rooms. We had a friend of mine that was at Elmhurst, and I would text him, and he will send out somebody, and they will pick up the supplies. We'll give them also some cookies, some food, and then about a few days later, we'll have more masks and gloves, and we'll give them more supplies. And that's how it went for about 11 days. We were able to give many masks, many supplies from our offices. We had about 80 volunteers, and we didn't know. We had about 11 to 20 days till the peak of the virus. At that time, we saw that the cases were doubling every 3 days, and we were scared, and we just wanted to help. And it's definitely a New York spirit. Everybody just stepped up the game. So
That's fantastic. I wanted to follow up with a couple things you said there that are interesting, particularly regarding that you wanted to work as nurses, as you said, but that you weren't allowed to do that. Could you explain that a little more? Did people actually attempt to, or show up, or what happened there?
The Department of Health was looking for volunteers at that time. They wanted to have people to come to New York City to help out, and we are medical professionals, but we don't have experience in COVID-19 ICU situations. We don't know how to use a ventilator. Most of the hospitals had turned into COVID-19 facilities. They didn't have regular hospital areas. The emergency room was COVID-19 emergency rooms. So we didn't have the expertise. And definitely the hospital didn't want to put us into a space where people were just dying. They didn't know how to help them. And that could actually traumatize a lot of the dentists. Imagine you're working on teeth and suddenly you go into an emergency room and everybody's dying around you. You cannot help them. Even the medical doctors were traumatized. I'm sure you heard there was somebody who committed suicide. It was on the news. And I'm pretty sure there's going to be a lot of post-traumatic stress disorder after this in New York City. We're going to need a lot of help.
Yeah, I'm sure about that. Well, I'm going to come back and follow up some more with you on some of those things. We're going to learn a lot that's going to change us forever in many good ways, too, I believe. Suchi, you're on the front lines. You're both a dentist and a physician. You're an oral surgeon. What have you been doing during this pandemic? Can you tell us a little bit about that?
Sure. So just a little bit of statistics originally. So by March 20th, we had about 3,254 cases. And by March 23rd, it was up to 5,707 cases in New York, which was quite a significant increase. Initially, we started on March 7th with only 29 cases. So the cases were increasing at an exponential rate, and all the sectors in New York were being hit hard. There was a lack of hospital beds, lack of manpower, lack of PPE, lack of ventilators. I'm sure you heard every state fighting for ventilators. But
Yes.
The beauty and resilience of New Yorkers was brought to the test. It was amazing how all the New Yorkers came together. Like Ioana said, we got, Department of Health sent out letters. People wanted to volunteer in conjunction with the New York County Dental Society, in conjunction with AO. We started a PPE drive. And basically what the hospitals did was they basically started discharging patients that were stable. All elective surgeries were deferred. All the staff was deployed in various capacities to help with the COVID battle. Residents in training, they were working instead of their own specialties. They were in the ICU. We were even at the hospitals in the oral surgery clinic. They were only seeing emergencies, and they were very strict guidelines. There was no aerosolizing procedures being done, and they were asking if somebody can be put on antibiotics and palliative measures and to defer the treatment. There were specialists. My husband's an oncologist as well at New York Presbyterian, and every specialty was getting pulled in, and they were asking if you are an oncologist, are you able to act as a hospitalist? So that way the hospitalist could work in a different capacity with a different patient. People were being pulled in to work as intensivists if they had the knowledge. They were also asking doctors and surgeons. They were working in the capacity of nurses. They were pulling people to just make phone calls to the families and tell them about their family members' status. So it really, really pulled all of the health practitioners in different directions. Again, like Lois said, New York strong, as I'm sure you know, the enemy was getting stronger and the battle was just full on, and we were just preparing for it. The hospitals were filling up to the capacity. So then on March 27th, Jacob Javits Center was reconfigured into a 2,500 bed hospital by the Army. The original plan was to use it for non-COVID patients, and they were planning on transferring non-COVID patients from all the hospitals. But unfortunately, the COVID patients were increasing so rapidly, they decided that at this point, that Javits Center would accept COVID patients as well. And then on March 30th, the USNS Comfort arrived at NYC, which had 1,000 beds and 12 operating rooms. In addition, the Samaritan Purse Emergency Field Hospital opened in Central Park on April 1st, which was surreal to see hospital in the middle of Central Park. And they were working in, and it was in collaboration with Mount Sinai. There were 14 tents comprised of 68 respiratory care units and 10 ICU beds equipped with ventilators. So New York City was very surreal. At nighttime, it would get quiet, but all you heard were the ambulances going by. I also did see some emergencies in my office. AMOS sent out, which is Association of American Oral Maxillofacial Surgeons, sent out an email blast. They didn't want us to inundate hospitals with dental pain, dental issues. The only good thing was, even when I saw emergencies in my office, the only thing I personally needed at that point was an N95. I tend to wear gowns. Even in my office, I've worn them since I've been in practice, over 10 years. So I had the gowns and everything. And again, I really tried dealing with every patient without using any aerosol sprays.
Right.
Just to take
Which
care
means
of
you
their
couldn't use a
immediate
handpiece.
needs. Yep.
You couldn't use a handpiece, really.
Yeah. And
So that means no emergency complicated extractions of third molars or something like that. would have been
It's amazing.
challenging.
You realize how resilient you can be and how creative you could be as a human race when
Yeah.
the need arises. And I think, again, it's New York City. People are so good at morphing into what they need to morph into.
Yeah. I have a couple of follow-ups, just a quick one right now. I'm going to go back to Lois, but I wanted to know, how did they manage this reassignment? You just mentioned, they said that your husband, the oncologist, maybe could act as a hospitalist. Maybe the hospitalist could do other things. Who was managing this sort of like going around saying, okay, can you do this? Can you do that? Who was doing this?
It was from the intensive care units. Also, they were looking at people's experience. So how many years have you been out from general surgery or medicine? And the longer you have been out of the basics, the less likely you are to be good at it. I don't want to say remember all that information, because at one point I used to work in an ICU when I was a general surgery resident. But like Ioana said, doesn't necessarily mean you could be and act as an intensivist. But again, the program director of oral maxillofacial surgery at Elmhurst Hospital, he actually was in an intensive surgical intensive care unit. He's a very bright guy, and he was able to, there was somebody overseeing him, and then he had patients under him. So it really, there were a lot of considerations that came into play, and the hospitals really, really did try to utilize the people in the maximum capacity that were in those specialties.
Well, we're going to learn a lot after COVID about supply chain, and supply chain doesn't just mean masks and gowns. It means people and skills and education and all kinds of things. And it's going to, a lot of good will come of it. Lois, I want to come back to you and turn back to the private practices in New York. One of the largest concentrations anywhere in the world of private practicing dentists. They say that if you're a sales rep in New York, you only have to stay in one building and you can have all your accounts together. That's how many dentists there are. So what happened in private practice? I know it shut down, but what about seeing emergencies? Was that particularly challenging in New York?
Well, this is the way it panned out, Joel. We had been hearing about COVID-19 and that it was spread by aerosol. And in our practice and in many practices, we started to screen patients. All patients had to use Purell. We tried to decrease aerosol. We stopped using the Cavitron and Prophy jets. We started doing hand scaling and toothbrush Prophys. We started doing triaging of cases that really didn't need to be seen at the moment and that could be put off for later. So we started that before the governor shut us down on March 20th. And let me tell you what we did. We were not considered essential workers, but we were allowed to do emergencies. And there were lists of what essential care was and non-essential care was, and we were asked to adhere to those guidelines. And teledentistry really entered into this because there were many patients were triaged before they came to the office, and also, if we could, they were given advice and instructions, antibiotics, analgesics, what to look for through teledentistry. So we started doing that after March 20th. And one of the things that the Dental Society, New York County Dental Society, did is that we created a list of dentists who were available for emergencies. And even though we were all supposed to be available for emergencies, there were dentists who, because they had underlying conditions or because they were quarantining because they had been exposed to COVID or they were COVID positive, they needed a list of available practitioners who could see their patients. And in addition, there were patients whose dentists were not available or who did not have dentists, and they could use that list also. So we reached out to our members and our non-members to volunteer to be part of that emergency list.
I see.
And that was an important thing too.
That's great. Ioana, I'm going to come back to you about the same thing. You treated emergencies, and maybe if there's anything different or additional to what Lois did, you could tell us. But also, before I get you to answer that.
Yes.
You talked about the volunteer efforts and getting PPE,
Yes.
and it's really an incredible feat. And Lois had told me a little bit about that before.
Yes.
The hospitals were ready and willing to accept this, and you felt like everything that you collected from all the dentists was utilized in a good way?
The hospitals were running very low on supplies. At a certain point at the beginning of April, they only had, it was, let's say Sunday, they only had supplies till Wednesday. So you can imagine how much they needed it. They didn't even have masks for the respirators. We were talking to the emergency room doctors, and they were telling us that they needed to have more masks because if they were going to split the respirators, they needed to have more supplies. And they didn't have enough masks for what they were using the same masks again and again between the patients. So we ended up collecting masks from dental anesthesiologist offices. We had masks from our emergency oxygen units in our offices. And these masks are like $125 each, but nobody cared. Everybody was donated because we knew that they needed it. There was no supply at that time. It was really scary. I've never seen this before in my life.
Yeah. And did you see emergencies yourself in your practice?
I did. I saw emergencies in my practice. And at that time, there were no guidelines from the American Dental Association. There was nothing. So I just had a level 3 mask. I didn't have any N95. And I just prayed to God and I said, okay, hopefully I'll be okay. And I was. But honestly, I mean, my patient was in pain and I had to go to the office. I asked them if they were okay. They told me they were. I took their temperature because that's what I had heard everybody else was doing. And we had forms that we had created from the Dental Society, actually, for consent forms. And I used those forms. I went in, I used my level 3 mask. I did what I had to do. I had to do a pulpotomy. I did a pulpotomy, and that was the end of the story. So.
Okay. Good.
Yeah.
That's a New Yorker. Yeah.
We're strong. We're strong here.
Yeah, there's a whole story about that. We'll have to come to another time. Suchi, I heard a lot of interesting things about what you told us, and as I said, we're going to have a lot of learning after this about how to change education and how to prepare us better for other things as well. Dental education has talked a lot about sort of a merger with broader healthcare, with primary care medicine. I would imagine that when we start having that conversation to a fuller extent, that you're the kind of person we should go to talk about, how can you're already an MD and a DDS as an oral surgeon, and, how can we prepare our dental students so that when they are practicing, we can be more available. Because as we heard from all of you, everybody wants to help, but there wasn't a sort of a connectivity to make us as available as we could be with the right training. Do you have a comment about that?
So, Joel, there's a couple of things. Medicine falls under the Department of Health. Dentistry is in New York under the Department of Education. So there's two very varied departments. So I think part of the difference is there. In the hospital, it's very different. If you look at, and this I'm talking about postgraduate level. Now, again, GPR is mandatory in New York. So you have general dentists in hospitals that are doing their GPRs, and then you have the oral surgeons and the pedo and different specialties depending on the hospital. And I think they try to incorporate those dentists into this mix. Regarding incorporating dental education and medical education together, I think it's a little bit tough, again, unless you are in an institution like Columbia, where the dental and medical students do their first 2 years together, versus at NYU, it's completely separate. I think at some point they will come together and come up with some guidelines if this were to happen again. And in preparation, numbers are power. So they could absolutely use students, but again, then the opposite is how useful, and that's sheer statistics and benefits, how useful is a first year or second year student versus trying to get somebody who has some experience. I think there's a lot of things that come into the mix. But again, I think depending on what role you want them to play.
Right.
So that's my thoughts,
Well, I think we'll have a lot to learn from you, though. I think there's a lot we can learn, and I look forward to a lot of debriefing afterwards.
Also, our clinics at the hospitals are starting to open, and now what they're going to be doing is, I'm going to go in on Monday, and they said we're doing a lot of teledentistry, televisits first before the patients will even come into for the procedure. So that's something that's going to be very similar in dentistry and in medicine. There's going to be a lot of telehealth going on. The only difference is, I think, with dentists, if you're going to compare them to, you compare them more to surgeons because it's procedure based. So there's only so much you could go with an exam or with treatment. At some point, you need to have the patient come in and see them.
Yeah, that's great. So Lois, you're in recovery now, and maybe you could close by giving us some of the inspirational words you said to me about, New Yorkers being special, about recovery. And I have a feeling we're all going to see each other at the Greater New York Dental Meeting this year, but maybe you can comment on that too.
Joel, first of all, thank you so much for allowing us to tell everyone about what New York City was like. We weren't cowering in the dark. We were strong. Many of us supplied, as Ioana was talking about, sent supplies to hospitals, sent food to hospitals, were involved with every aspect of what was going on in our city. But right now, we're not ready for re-entering. Our governor is deciding how to open up all of the counties in New York based on metrics. And certainly because of our history, we are, and being the hardest hit, it's difficult to meet his metrics, but we will, due to the efforts of New York State Dental Association and our grassroots efforts. We've been educating the governor into why we should be reclassified as essential workers and allowed to go back into our practices and see our patients that in many cases need us to see them because they've been dealt with in a palliative way, and now it's time to institute treatment. We have been communicating, everyone has been communicating with each other as to what best practices are, and also and with our patients. We've been in my own practice. We've had multiple emails that have gone out, videos. We even hosted for our patients a puppet show to bring them together and to show them that we really care about them. And we've been doing a lot to make sure that everyone in our practice is educated as to what's happening, what we're doing to keep them safe, and that we're eager to get back to work as soon as we can. And that's basically it.
That's fantastic. Yeah, New Yorkers are resilient, and I fully agree. It must have been very eerie, too, as you referred to the sounds of several of you referred to the sounds of the ambulances, and that in the absence of horns honking, of taxis honking at cars to move, just the silence and only the ambulances must have been very eerie in New York. But in spite of that, yes.
But there's one thing that I have to mention.
Yes.
That shows you how New Yorkers come together. Every night at 7:00, there are people come to their windows and on their balconies and in the street, and they applaud for the essential workers, the healthcare workers, people working in supermarkets, and everyone. The fire department rings their horns, and we all say thank you to everyone all the time.
Yeah. Well, thank you, Lois. Thank you, Ioana. Thank you, Suchi. Thank you so much for all you did. And all of us have been thinking about you in New York this whole time. And we look forward to the recovery and a strong recovery for New York, as we know will happen. And as I said, seeing each other hopefully this year at the Greater New York Dental Meeting. So thank you very much.
A pleasure, Joel.
Thank you.
Thank you.
Thank you.
Yeah, it was wonderful. And thank you for tuning into Pedo Teeth Talk, where we bring you the contemporary issues important to you and your practice, brought to you by the American Academy of Pediatric Dentistry. We'll see you here next time.
Do you need additional CE hours but don't have time to travel to courses? Did you attend annual session and want to listen to the audio recordings? check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.